As at the 1st of March, there is no new confirmed case in Nigeria. About 13 or 14 tests have been done, and except that one patient, no other person has been diagnosed. There were 156 passengers on the manifest of the flight that brought the index case. Port Health Services and NCDC have been supporting both Lagos and Ogun State governments to carry out contact tracing and other response activities. Currently, the contacts of the index case are identified as 19 contacts in Lagos, 39 contacts in Ogun State. We are in touch with these contacts who are under supervised self-isolation, and the states have provided them with temperature monitoring tools. I didn't see the taxi driver, but he has been identified. He's under observation, and he's going to be monitored for the next 14 days, as all the 19 people in Lagos monitored, and they're all on self-isolation in their homes. The airline that brought him, the patient, the index patient, has been, of course, notified of the patient, and they have been advised to put their crew also on observation, the crew that came with them. Plateau State government reported 4 suspect cases among Chinese nationals on the 29th of February. None of these cases have any symptoms. They have all been tested at the Nigeria Center for Disease Control reference laboratory, and they are all negative for coronavirus infection. The state has placed them under supervised self-isolation for 14 days. We continue to monitor the global situation, with cases spreading quickly in countries as they are doing now. As at 1st of March 2020, there have been a total of 87,137 confirmed cases. 95% of them have been inside China. There have been 2,977 deaths across 59 countries which are affected. There are 3 countries affected in Africa: Egypt, Algeria, and Nigeria. There is ongoing community transmission mainly in 5 countries: China, Korea, Japan, Italy, and Iran. Advice for Nigerians: we should all remain calm and avoid panic at this time. Everyone is to regularly and thoroughly wash hands with soap or use alcohol-based sanitizer to disinfect your hands. Maintain 1 meter distance between yourself and anyone who is coughing or sneezing. This is called social distancing. Make sure you and the people around you follow good respiratory hygiene, which means covering your mouth and your nose with a handkerchief or tissue when you cough or sneeze, or if you do not have any of those immediately at hand, coughing or sneezing into your bent elbow. No school should be demanding that children should bring face masks. That's not a requirement. That is not something that the government has advised. And individual principals can wake up and then make demands that are not in line with general policy. So those who have serious illness, I can imagine that those who have serious illness, if somebody has cough and catarrh and has to do an exam, I can understand that such a person is given masks. They should actually be given masks. Anybody who has chronic cough or catarrh must see a doctor and stay home. But if, for example, they have to be at lessons, they have to be doing exams, then they should be supplied with or given masks for that purpose. But I do not see that it's necessary as a matter of routine for everybody in the school, and it should not be enforced at all. I am particularly proud of the response that has happened. We have been preparing since January when this news first came out, and asking questions, having meetings. We had a meeting on the 31st of January when we didn't even know that or when or if the virus will reach this place. So by the time it appeared on the 25th, the response was excellent. Patient, he wasn't a patient at the time. He arrived here on the 25th. He went to a hotel in Ikeja. He spent the night there. That hotel has been found, all the contacts there have been interviewed and put on isolation. The room he stayed in has been decontaminated, has been fumigated, and even the taxi and that he went in also has been treated. And on the 26th, he started feeling unwell, and he reported to a hospital. I'm sure they tried to diagnose malaria, but immediately it was negative. They immediately had the index of suspicion to refer him, and he was referred to the infectious disease hospital, and there they didn't waste time. That same night, they called me, and I said, it is very good that you do this test. They went on to do that test, and that same night, by midnight, the result came out. So the whole thing took less than 48 hours. That is very fast and very commendable, and I'm particularly proud of the team. They worked like clockwork without delay. So in less than 48 hours from the 26th, in fact, barely 24 hours, we had our result. From the time the man complained to when we had our diagnosis, just over 24 hours, which I think is excellent. It's a very good test case. And this, if you look at it as a test run, we have done very well here. And I think that the team deserves a commendation for that.